Welcome to a brief presentation on shared decision making and the health promoting health service. This is John's story. The concept of the health promoting health service is that every health and social care contact is a health improvement opportunity and recognises that treatment is not the only consideration to improve health and well-being. Through the lens of the health promoting health service, shared decision making provides a health improvement opportunity. By using the Realistic Medicine 5 Questions resource in practice, this can help with collaborative conversations around what matters most to people before any test, treatment, or medicine is considered to ensure personalised care. This resource and process can help to identify and address any health behaviours and wider social and economic factors that are impacting a patient's condition and their overall health and well-being. So what does shared decision making look like in the context of the health promoting health service? Here we want to show you John's journey and the importance of shared decision making and incorporating opportunities and interventions into the process to improve health and wellbeing outcomes. Meet John. He is a 57-year-old man who lives alone and is currently unemployed. He smokes about 30 cigarettes a day and drinks up to 5 cans of beer every night. He was recently diagnosed with type 2 diabetes. A wee while later, John begins to feel unwell. He visits his GP complaining of headaches and dizziness. His GP identifies that he has high blood pressure and he is prescribed medication. This is the first opportunity that we have seen where a shared decision making and a health improvement conversation could have taken place. If a shared decision making conversation was had at this point, John would have been given an opportunity to discuss other options with his GP, which may have involved weight management, quit your way, and alcohol brief interventions to address potential lifestyle changes as opposed to or in addition to medication. This was also an opportunity for John's GP to check in with him about his understanding of his medical plan and the medication he has been prescribed. There are often barriers that prevent shared decision making from taking place, which can include health improvement conversations. These can be misunderstandings around shared decision making, where practitioners believe they already do this, but with shared decision making, we need to be listening as much as we speak to find out what is important for the patient. Or it can be a lack of confidence. Some practitioners worry that they might not have the right information or answers for a patient. For example, in a shared decision-making conversation with John, his GP would discover that John is engaging in smoking and drinking alcohol in excess that could be playing a role in the headaches and dizziness. His GP might not know who to refer him to. Within the Health Promoting Health Service, we aim to provide patients and practitioners with this information to address alternative, holistic needs that are related to the visit. This not only alleviates recurrent visits, but helps to improve the quality of life for patients and our communities. Many believe that a shared decision-making conversation is time-consuming, but research actually shows that it saves time down the road. Taking the time to have these conversations early on will not only help to improve health outcomes for our patients, but helps to improve patient autonomy and self-management over their health. Some practitioners believe that patients don't want to be involved in decision-making and mistake silence as an indicator that patients do not wish to be involved in their care plan. But it is often difficult for patients to speak up due to power imbalances. We should be encouraging our patients to consider what is important to them and listening to their perspectives. Health literacy is often a hidden issue, leading to practitioners mistakenly believing patients understand their options for care. For John, this may have been the case, and he might not have understood the importance of his diabetic medication or the medication his GP gave him for his blood pressure. leading to unregulated or missed dosage and potential readmittance. Next, in John's journey, he goes home from his visit with the GP and resumes his lifestyle of drinking and smoking in excess. A friend comes to visit and finds him unconscious. He calls an ambulance and John is taken to the hospital. While in the hospital, John is admitted to accident and emergency, where he is diagnosed as having suffered a severe ischemic stroke and the doctors carry out a thromboectomy. While in the hospital ward, he starts to recover from his stroke and begins rehabilitation. At this point, there is another opportunity for a shared decision-making and a health improvement conversation to occur. Having a shared conversation with John during his recovery may allow for the hospital staff to identify additional needs that may reduce the chances of further ill health and improve his health outcomes. The Health Promoting Health Service is working on developing a holistic needs assessment tool to be utilised in patients' care plans to help staff identify holistic needs outside of the acute setting, with the appropriate links into services and programmes to see them through. A shared decision-making conversation may put John in touch with the appropriate services to support in his recovery and provide social support. The Health Promoting Health Service works in collaboration with Realistic Medicine to support in shared decision-making to help bridge these gaps and improve health outcomes. The first pathway we are considering is one in which a shared decision-making conversation failed to take place. After recovering in the hospital for several weeks, John returns home and begins to drink heavily. After a short spell at home, John becomes unwell. He is then readmitted to hospital. One of the reasons for John becoming unwell may have been due to the missed opportunity for a shared decision-making conversation. This health improvement conversation may have helped to identify John's lifestyle behaviours that included drinking in excess, which may impede his recovery from the stroke and managing his diabetes. If you look at the path from being admitted to hospital and being able to go home, he's having to go through that journey all over again. This is the alternative pathway in which John engaged in a shared decision-making conversation with a member of staff that helped to identify holistic needs after his stroke that could potentially reduce further ill health while helping him to make decisions about his care and recovery. Shared decision-making conversations are patient-centred and should provide the individual with all treatment options in a succinct, understandable way to allow them to make the best decision for them on an individual basis. For John, this may look like a conversation around the different pathways of care following his stroke, which could include physiotherapy, speech and language therapy, and the different medications he was prescribed. Having had a shared decision-making conversation with John's practitioner during his original admittance, together they would have explored what was important to John and identified vital elements of his lifestyle that could be impacting his health. Depending on the severity of the stroke, he may be eligible for assistance with housing, benefits, and support from carers. Being unsure of how to access these supports may be further distressing, which could also impact his health. John's journey through the healthcare system was complex without the person-centred, shared decision-making conversation. The Health Promoting Health Service supports shared decision-making by routinely opening discussions with patients the potential for health improvement opportunities in their lives and the benefits of such opportunities on their health and well-being by means of a holistic needs assessment. By taking into account the social determinants of health, these assessments help to improve health outcomes for patients and support their clinical treatment, rehabilitation, and ongoing management of long-term conditions. The easiest route for John, and one which supports realistic medicine principles, is one in which he was at the centre of the decision-making process. Through being empowered to express his concerns and preferences to the options provided by the healthcare professional, The treatment pathway was agreed with Joan at the centre of the decision-making process. For more information on shared decision-making, realistic medicine, and a health-promoting health service, please visit our pages. If you're interested in learning more about shared decision-making, there's a comprehensive module on Shura's available to all NHS staff.